Good morning, everybody. Dr. Zach Long here, lead faculty in the Fitness Athlete Division for the Institute of Clinical Excellence. It is Friday, November 2nd, and Friday means that it is Fitness Athlete Friday, the best day of the week here on the PT on Ice podcast. Today we're going to be talking a little bit about loading in the clinic, specifically the utilization of kettlebells and a couple different exercises that are good to use with kettlebells in the clinic as part of our rehab plans. This pains me to say as the barbell physio, but I truly believe that kettlebells are an essential piece of strength equipment to be in physical therapy clinics for a couple of reasons. Number one, they take up very, very little space, which is really nice when most of us have crowded clinics already. So compared to a barbell and weights, the amount of area you need to implement these exercises is going to be a little bit smaller. That's nice. Number two, they're relatively inexpensive. Three, they don't require any real maintenance. If you get a barbell, you need to, every now and then you're going to have to take some time and kind of scrub off the rust. You're going to have to lube up the sleeves, etc. There's really not much you have to do with kettlebells. Number four, they're just really easy exercises to implement with individuals. And number five, they're just not really intimidating. You'll find a lot of people that as soon as you bring a barbell out, even if it's just a 45-pound barbell, 35-pound barbell, even a 15-pound training bar, that are just going to be simply intimidated by that apparatus, which is an entire different rant for me to go on a different day because it breaks my heart that people are intimidated by a barbell. But the kettlebell is just something that you could set a 45-pound barbell on the ground, you could set a 45-pound kettlebell, and 9 out of 10 times people in the clinic are going to be less intimidated by that 45-pound kettlebell than they are the barbell. So it makes for a easier transition into heavy loading for a lot of individuals. There are also some negatives to it. For example, that you're not going to be able to find a 400-pound kettlebell to deadlift. So if you're really trying to push maximal strength in a lot of populations, going with the barbell is going to be a better option. But I think kettlebells, like I said, I think they're essential for the modern physical therapist to have. If you want to be truly loading patients in a rehab setting, I can't think of a better implement to do that with than a kettlebell. And so we're going to talk about a couple of my favorite exercises to use kettlebells with in the clinic in physical therapy plans of care. First up is the goblet squat. The goblet squat is a great exercise to use in the clinic. So goblet squat is simply holding a weight directly in front of your chest. And that does a couple things. That can be done with a dumbbell. That can be done with, holding a plate out in front. A kettlebell is just nice because it's a little easier to hold on to a lot of times. But having that weight out in front does a number of different things. First of all, for a lot of individuals with their squat, they have a hard time with their anterior to posterior balance. Meaning as they're squatting, they're getting too forward on their toes or too backwards on their heels. That little anterior weight, it just seems to solve a lot of those issues. That counterbalance makes getting down deeper into the squat a lot easier. So for a lot of individuals, that will automatically allow them to squat to more depth. And then you can do things like if somebody has, for instance, a poor air squat or poor back squat, you start them with a kettlebell and maybe a relatively heavy kettlebell because it gives them a little bit of assistance. And then to progress them, you decrease the amount of weight of the kettlebell. So you're actually decreasing the amount of assistance you're giving them, or vice versa. Say somebody's getting stronger and we're working on loading them, you can obviously increase the load on the goblet squat. The big problem long-term with the goblet squat for most populations is going to be that you're actually going to be a little bit more limited by how much weight you can hold with your upper body than by how much weight you can push with your legs. So for instance, if somebody comes to you and they're squatting 300 pounds, well, you're going to have a hard time loading them up heavy enough with a goblet squat to get their legs significantly fatigued, and instead you're going to find that their arms and upper back are the muscles that give out on you first. So goblet squats are great for that anterior-posterior balance, for initiating some loading. They can also be great for a number of different mobility drills. Like I said earlier, that counterbalance makes it really easy for a lot of individuals to squat a little bit deeper than they normally could, but we can use it a couple other different ways. So after I do hip mobilizations or have somebody do some hip stretching, I'll often have them do what we call eccentric isometric goblet squats, where they just go really slow through the eccentric phase, somewhere between 3 to 7 seconds. Then they do a 2 to 5 second pause in the bottom where they're really owning that bottom position, and then they explode up fast. I'll also use goblet squats with a little bit of an ankle dorsiflexion bias. So I'll have the individual do a goblet squat down, and then when they get to the bottom of the squat, they're actually going to rest their forearms right on their knees. And then they're going to let that goblet squat and their forearms resting on their knees pull their knees forward in the bottom of the squat. So that makes for a great ankle mobility stretch. It makes for a great follow-up to ankle mobility work. And it's awesome for Olympic weightlifters, CrossFitters who actually need to learn to squat with a little bit more of an upright torso, because that upright torso is going to better translate to positions in the squat variations that they're doing. So the goblet squat with an ankle dorsiflexion bias is a great move to do. And you can also use a goblet squat for some thoracic spine mobility and strength. So you want to go with a lighter kettlebell on this variation, but you're going to have an individual goblet squat down, keeping their elbows nice and tight. They're then going to press that kettlebell straight overhead. And that overhead press is going to really make them work their thoracic spine extension. So you get a little bit of mobility work out of that, or you get a great follow-up to your thoracic spine mobilizations, manipulations, or whatever thoracic spine passive stretching you have them doing. So those are a couple great drills to keep in mind with the goblet squat. Exercise number 2 that we're going to talk about is going to be kettlebell deadlifts. We've talked multiple times before on the PT on Ice podcast about how strong ICE as a whole believes in deadlifts being part of certain individuals' rehab plans, and that we believe that physical therapists as a whole need to have a really solid understanding of the deadlift. Now, don't mistake that. We're not saying that everybody in the world should be deadlifting with their back pain, but it's something that a lot more physical therapists need to be good at across a broad, wide range of patient populations, not just fitness athletes. But like we said earlier, that the barbell is intimidating, and you'll find a lot of individuals that are really scared of doing a barbell deadlift. And a great way to initiate the deadlift is by having them use a goblet deadlift, or excuse me, a kettlebell deadlift. The kettlebell deadlift has one really good advantage to that besides just the intimidation factor. Because you've got that one narrow handle on the kettlebell versus the long barbell, it makes most individuals actually get closer to the middle of the weight. So the barbell is always going to sit a little out in front of the athlete's center of mass, just a little bit. With the kettlebell, you can pretty much get directly over it. And that just a little bit of change, and we're only talking about a couple inches right there, can really help a lot of individuals dial in their technique and actually decrease a little bit of the loading on their low back so they're a little less sensitized by that movement. And so you'll find a lot of times when you're trying to initiate deadlifts with individuals in the clinic that go in the kettlebell deadlift variation is just an easier introduction to that loading than a barbell can be at times. Number 3, arm bars and Turkish get-ups. So I'm putting these kind of in the same category because I use them both for the same thing. I know a lot of people will talk about Turkish get-ups as being a super functional exercise because you're using core, you're going into hip extension, all sorts of stuff. To be honest, I just don't think the load through all of those joints is enough to create any sort of adaptive response. The only thing that I do think it's a heavy enough load on to create an adaptive response or positive training effect on is really going to be the shoulder and the shoulder stabilizers. And so for the Turkish get-up, which I think most people listening are probably going to be fairly familiar with, arm bars people are less familiar with. It's basically you start supine and you use one leg to roll onto your side so that your torso is vertical, your arm's vertical. In both of those movements, basically what we're doing is keeping a stable arm, so we're not like actively trying to move the shoulder, and then we're moving the body around the arm. So for a lot of individuals with kind of hot shoulders that don't like actually performing a vertical press or a horizontal press or horizontal abduction press, moving the body around the arm and shoulder can be a great way to start training those muscles and joints through a larger range of motion in a way that's going to less sensitize them. So doing something like a Turkish get-up is a great way to introduce an individual to overhead pressing or overhead lifts when their shoulder has been really irritated for a period of time or is in that highly irritable stage. It just makes things a lot easier. And then for a lot of individuals that just have some significant shoulder instability, both of those exercises are great to work on kind of their neuromuscular control and getting them feeling more confident in these awkward positions that quite often will end up reproducing their symptoms. So we get their rotator cuff, their shoulder stabilizer muscles really working in these awkward positions. And I tend to find that with my shoulder instability patients, they tend to begin to get a lot more confident in their shoulder strength when we start implementing things like kettlebell arm bars and kettlebell Turkish get-ups. So really powerful exercises to use in the clinic. Following along that same line of thought, bottoms up presses, where instead of having the kettlebell kind of resting down in the forearm, we actually flip it up. So the weight is sitting above the hand. It just creates a lot of added instability to the equation. And so you can use a lighter weight and still get a significant training effect with these bottoms up variations. So sometimes people that are load intolerant in their pressing, we can go bottoms up presses. It's going to make them go a little bit slower, focus on control and positions, and make their stabilizers work a little bit harder. Bottoms up presses become a great variation to use there. And then I'll tie that into the fifth exercise we'll talk about. I'll also use bottom up carries a lot. So for individuals with rotator cuff pain, doing bottoms up carries can be a great way to get some isometric work on their rotator cuff without moving the joint and muscles through a lot of range of motion and irritating them if they're kind of sensitive to that. So going bottoms up carries can be a great way to start introducing more loading into the shoulder joint. And number 5 is just going to be carries in general. Kettlebells allow for a wide variety of carry options to train and strengthen a lot of different things. From doing farmer's carries where we're holding weights at our side. I'll quite often do farmer's carry or suitcase carries where we hold it on one side. On people needing lateral hip strength or runners needing to start working on their strengthening, and just have them focus on maintaining a really tall upright posture as they walk, or we can turn that into marching drills as well. We can go into front rack carries where the individual has kettlebells in one or both arms held right in front of their shoulder, and then we walk with that, or we do lunges with that, or we do step-ups with that. And being in that front rack position is a great way to strengthen the thoracic spine, which in a lot of fitness athletes, you'll find that they actually have some weakness in their thoracic spine extensors, or with a lot of individuals with low back pain. That can be a way if maybe they're not ready to do something like kettlebell deadlifts from the ground. Maybe you don't feel like that's going to be beneficial for them or they're too intimidated. Having them do some front rack carries with a relatively heavy weight, we're not going to be really moving their back through motion, but we are going to be challenging those spinal extensor muscles. And then we can also do a wide variety of overhead or 90-90 position carries as different ways to work shoulder stability or different ways to work on our ability to control where our pelvis and spine is positioned while we're in different ranges of motion. For example, a lot of times with individuals that I'm working on improving their overhead mobility, if we get them to where, we improve a little thoracic mobility with a manip and some stretches, if we improve some shoulder flexion with some soft tissue work followed by some active drills that they've done to isolate that, then we hit them with a heavy bilateral overhead carry. So now I ask them, all right, so Doris, when you do your overhead presses, you've been having some back pain lately because you tend to overextend your lower back to make up for your shoulders and thoracic spine being tight. We've now spent some time mobilizing that and getting it better. So now let's work on you controlling that. Let's do a bilateral overhead carry where you're working on not extending through your spine, where you're working on just getting your shoulders as open and active as possible, and then get to walking with that. So there you got 5 drills that I like to use with kettlebells in the clinic, my 5 favorites. Bottoms up presses or bottoms up variations, goblet squats, deadlifts, arm bars / Turkish get-ups, and carries. If you want to dive a little bit deeper into using kettlebells in rehab, or maybe you work with an older population and you want to know how do I implement these with that population, because they do have some special considerations. ICE faculty member Dustin in our modern management of the older adults has created a great video that you can download for free, talking about different modifications that you can make with kettlebells in the clinic for the older adult population. And if you want to check that out, you can get it for free at bit.ly, so bit.ly /KB modifications. Again, that's bit.ly /KB modifications. And there's no dash or space in that KB modifications. So that's a great resource if you want to implement kettlebells with older adults, to just talk about a couple different variations you can use to match your patient population needs. And if you just want to dive deeper into more strength equipment that you can utilize in your physical therapy clinic, the Fitness Athlete Division has created an ebook for you on what the 10 best pieces of equipment we believe should be in every physical therapy clinic for people wanting to actually create true strength changes in the patients that show up in their office. And if you want to download that ebook, which talks about kettlebells, barbells, pull-up bars, suspension trainers, and a lot of other things, as well as share some of our favorite exercises, you can do that. Hold on, I lost y'all. You can do that at thebarbellphysio.com/ebook. So those 2 sites were thebarbellphysio.com/ebook and bit.ly /kettlebell modifications. Hope everybody has a great weekend, and we'll catch y'all soon.